Hello everyone, we are at Salient Lifestyle Center in Elgin. Thank you for coming to the live audience. And for anyone from home, we would love to have your interaction. So please feel free to put comments or questions into the chat. So we have done this series called Food as Medicine. Today we will focus on part 3, which is going to be on preventing and reversing cardiovascular disease. The first presentation was, Can Food Be Medicine? Second one was focused on cancer, and this one will be focused on heart disease. So if anyone wants to look at our future events, you can go to foodasmedicine.eventbrite.com. And we have this recording available on YouTube channel as well as Facebook. So I am 𝗕𝗿𝗄𝗃 Garg, and I'm a family physician certified in lifestyle medicine. I also have a certificate in plant-based nutrition from the 𝗕𝗂𝗵𝗵𝗶 Institute. I work currently at 𝗪 Medicine Advent Health, primarily in Hinsdale and second office in Carroll Stream. And I am medical director of the Salient Lifestyle Center in Elgin. So today our focus will be, we will discuss the research on prevention and reversal of heart disease briefly. We will talk about, again, an overview of the mechanisms of heart disease. We will discuss the basics of nutrition of plant-based diets. Some of this, as you may see, will be a repeat for our live audience. And then we will talk about the benefits of phytonutrients and antioxidants. And then we will put it together, how to analyze a diet. Now, just know, this so-called diet has been around thousands of years. We did not know about vitamins and minerals and protein and fats way back. So just know, we humans are primed to eat a plant-based diet. And in the end, the analyses just work. So we're going to start with 34 seconds, and you'll find out why. So we're just going to do a little bit of silence for exactly 34 seconds. And so we're only going to have a chime at the end, okay? But I will tell you when to start. So when we start, you can pray, meditate, send loving thoughts to your friends, your loved ones, intercessory prayer around the world. So we will start now. Okay, that is 34 seconds. I have the sound turned off. And the reason for the 34 seconds was every 34 seconds, one person in the US has a coronary event. And approximately every 1 minute and 23, an American dies of one. So that's a pretty high death rate if you think about it. 1 out of 6 deaths in the US every year is related to heart disease. 620,000 will have first heart attack. 295,000 will have a recurrent heart attack. Recurrent heart attack, you'd think, why recurrent heart attack? Don't we have drugs? Don't we have stents? Don't we have technology, right? The problem is that many times we don't fix the root problem of heart disease, so people have a second heart attack. Just to see, who here knows someone who has had a heart attack or passed away from one? Yes, it's so common. You know, someone in any room will know. And then the last thing, which is shocking, 150,000 will have silent heart attack. Many times we see people with what's called congestive heart failure, or their heart function was reduced by half or even less than half. They have less than half left. And the reason is because they had a heart attack, they didn't know it. Maybe it happened in their sleep. So this is just a graphic. Number one cause of death. We are talking about 36% of American deaths. And the cost is shocking, and it's rising. This was 14 years ago. $316 billion in healthcare, medicine, and lost productivity. Huge cost. So the different types of heart disease include coronary heart disease, which is what our focus will be. There is also arrhythmia, so you may have heard of atrial fibrillation, and then heart failure. Now, heart failure can be related to coronary heart disease. So just know, if we are exposed to the Western lifestyle, which means generally sedentary lifestyle, Western diet, we should all treat everyone as if they have heart disease. So all male 65 and up, all female 70 and up should be treated as having heart disease. And I would say now the ages should be even younger. So look at this chart. This is a chart of how big different things are. So look at this list. How much do you see a focus on the left? How much do you see a focus on the right when you look at media? Right? Media focuses on the right. Those are a lot of things. Some of them, they're very difficult to treat. The ones on the left are where the majority of disease is. So when we look at the top three, heart disease, cancer, respiratory disease. Heart disease associated with diet. Cancer, let's say 1/3 or more associated with lifestyle. And then respiratory disorders, much of it associated with smoking, right? So we should be able to tackle those big causes of death. When I was in medical school, we were required to read Dean Ornish's research study. It had freshly come out in the early 90s. He was the first to offer documented proof that heart disease could be reversed by lifestyle. We are talking proof as in angiograms reviewed by what's called blinded reviewers who didn't know the status of the patients, and checked in triplicate, as in double checked, triple checked. Most patients' chest pain disappeared with heart disease. For 82, artery clogging reversed. Now, this is very different from the prevailing wisdom, which was heart disease is progressive, you get more and more clogged, and it ends in death, right? So this is very different from the prevailing wisdom. And at the time that Ornish did his research studies, the technology on stenting was just coming into being. So before Ornish, it was angioplasty, and what they found, they clogged up again. And then around that time, they did stents, and now the latest is a stent coated with a drug to prevent clotting. And guess what? They still clot up. So as far as the Ornish plan, the hallmarks of it were intensive lifestyle changes. Not just lifestyle change as far as the American Heart Disease Association said at the time, but we're talking 10% fat, which is very low compared to typical diet. We're talking 40 to 50% fat. American Heart Association diet, 30% fat. And then the next step, intensive low-fat diet, American Heart Association defines as 20%. So we are talking very low fat, meaning no oil, no butter, no cheese. And it was, a little bit of nuts, but very low on the nuts too. Now, why would you say low on the nuts? Because there was limited time and they couldn't do studies on healthy plant-based fats versus very low fat versus saturated fat. So this is how they did it. So aerobic exercise, stress management, smoking cessation, group psychosocial support for 5 years. And I can't emphasize enough the power of the psychosocial support, because there was a program on Nova. Anyone remember the PBS series Nova, right? Way back. And I was able to watch it. I saw it. It was amazing. The person who passed away suddenly was the one who didn't go to the psychosocial sessions. And he had very toxic relationship with his wife. He didn't talk highly, and it was just everything negative. So, but yeah, 1 year was the initial publication. And after I finished medical school, then the second part of it came out. which was 5-year. So 5-year research is very impressive for any research study. And what they showed is a decrease in the narrowing, so meaning a little bit opening of the arteries in the experimental group, and an increase in the narrowing, which means decreased diameter in the control group, and also 2.5 times more coronary events in the control group. So shocking difference. And you will see in this chart, what these charts are from the actual paper, and the line at the top shows the progression in the control group of the narrowing, and the bottom line shows slightly decrease in the treatment group. So not just stable, but decrease, which is pretty shocking. And then the other thing he noticed, which would be obvious to you, but it's important to show in a research study, the more compliant a patient was, the more adherent to the plan, the better the patients did. So just know in any research study, there will be people that won't follow it. They're still included in the experimental group. So despite all that, the research was shown. Then some years later at Cleveland Clinic, Dr. Caldwell Esselstyn published this. Now, interestingly, this was not published in a cardiology journal. This was published in my specialty, family practice journal. I was shocked when I read this. I remember reading it for the first time and watching the photos. So this is available. Anyone can download it. It's a free publication. And so these are the photos of the images. And what you can see on the left side is you will see a donut, right? Well, not an actual donut, but the heart is in a cross section. And so what you're seeing on the top is the red areas are with good blood flow. The green area is with no blood flow. So before the treatment, the arrow is pointing to the area that's the dead zone of the heart. And then at the bottom, we are talking 3 weeks after, that area is starting to get reperfused with blood. And you might ask, how can this happen in only 3 weeks? Well, because the arteries that you see are only part of the story. There are many arteries that you don't see, which are called a coronary microcirculation. Those open up more immediately. And there are channels that go through and they restore blood flow. On the right, you have the story of a physician who came to Dr. Esselstyn. And on the artery on the left, it is eaten up. You can see it's not open, it's eaten up, it's narrowed in many places. It was such a long area, it could not be bypassed, it could not be stented. So this man was basically walking dead to the cardiology community. He came desperately to Dr. Esselstyn. And Dr. Esselstyn took him under his wing. And then 3 years later, you can see that artery restoring the blood flow, which is miraculous if you think about it. So just to know more details of the study, it was whole grains, lentils and beans, vegetables and fruits, flax seeds, and then no oil, avoiding nuts, avocado, olives, those kind of things too. Because again, the time was limited. He just wanted to keep it simple, and he didn't have time to study that. Initially, it was only 17 patients. That was on the NOVA episode. And then, we're talking about our initial. So initially, it was 17 group of patients, very small. And then he expanded it subsequently to 177 patients. In the study, he included only those patients who stuck to the plan, and that's why the results are so dramatic. And so the total time was 44 months. The results were even more impressive, again, because these were patients who followed the plan. 93% had resolution or improvement of the symptoms. 22% reversed the disease on radiology or stress testing, as you see. And then 27 patients avoided stent and bypass. Average weight loss, 18.7 pounds, because it is a very high fiber, low fat diet. And again, those statistics are great, but there are stories such as Jim, his daughter was getting married. His goal was to dance at his daughter's wedding. And 6 months after he started, look at him, he's able to dance. Look at his smile, he's so happy. So there would be no way if he didn't change his diet to do this. So it's not just the numbers and it's not just the statistics, but these are real lives who are transformed. And just to give you an idea of the cholesterol numbers, so this cholesterol number of one example, 261 at the baseline, 126 after 10 to 14 days. Normally we think it takes months or years to change cholesterol. No, it changes very rapidly. And that's why in that one photo you saw such a rapid change. So again, you're seeing this imaging, and now you're seeing it in a U-shaped, right? The heart is supposed to be U-shaped. So on the left, the U shape has a missing bottom. It's not receiving blood flow. And on the right side, the U shape looks like it has restored blood flow. So this test is called a nuclear perfusion scan. And then we're looking at the heart in a donut shape or cross-section of the left ventricle. And you can see again the blood flow is restored. In this example, so the results are equally impressive, from 248 to 137. Shocking difference. And so just know, yes, these studies are very impressive, but the research on longevity of people following a plant-based diet goes way back. So you may have heard of Mediterranean diet, right? Why does everyone keep talking about it? Because it has very robust data with lots of numbers. And very interestingly, what many doctors don't know is there was a reanalysis of the same Mediterranean study showing a great improvement the more plant-based people got. So just to give you an idea, on the right side, you will see different levels of people doing plant-based. The green line on the right side is the line of people that are following it the best, the red line the least. So of the Mediterranean diet, it's not the fish, it's not the wine, it's not the oil, it is the vegetables, it is the plant foods within the Mediterranean diet which are transforming people and reducing the chances of death. This was statistically significant. And so just to go back to Dr. Estlund's study, which is TTC, treating the cause, his study shows the most benefits out of all the research studies on cardiac disease. So Courage study is showing study of stents, showing that only a small reduction in the cardiac events. So bottom line, this is the main thing to know. No other diet has been shown to reverse heart disease. Not the Mediterranean, not low carb, not the standard diet, not even the American Heart Association's diet, or the DASH diet that you may have heard of from the NIH, the DASH diet. Whole food plant-based is the only one that has been shown in multiple studies to reverse heart disease. And then you may think, oh, it's a fringe diet. But no, guess what? The American Association of Clinical Endocrinologists now has an official statement on plant-based diets. They have it in their guidelines. All patients should strive to attain and maintain optimal weight through primarily plant-based meal plan. And then they talk about polyunsaturated, monounsaturated fatty acids, which means plant foods. They're just doing it in scientific language. Now, the most expensive cholesterol drugs in the world are the injectable drugs we have today, which lower cholesterol greatly. We're talking lowering to the double digits, in the lower double digits or mid double digits. Very interestingly, you have them lowering the incidence of heart disease only a little bit. Even though they lower the cholesterol a lot, it does not mean they eliminate the risk of heart attack. So that's the important thing to know. They do help, yes, but they help much less than we doctors would have expected. And this fact, very few doctors would know. So then the areas where I colored in red, it's called residual risk. Residual risk, chronic inflammation, blood sugar, stress, lack of exercise, those kind of things matter. And they matter actually more than just the cholesterol. So you may have heard cholesterol doesn't matter. That's not true. But what I would say is there are other things which matter besides cholesterol, which are taken care of by plant-based diet, and then lifestyle as well. So one thing to know, I didn't put it on a slide, but there is research indicating high intensity exercise lowers the lowers the narrowing of plaque in an artery. That is, shocking information as well, which shows that exercise is also medicine. Food is medicine, but exercise is also medicine. And the both, so it used to be, Jack LaLanne was a very famous fitness expert. He used to say that exercise is king, nutrition is queen, put them together, you have a kingdom, and it's true. So this is, again, not to memorize, but just to show you, atherosclerosis is a process that leads to heart attack and heart disease. And the important thing for you to know from this slide is it starts in young age. We can see fatty streaks, the very rudimentary beginnings of atherosclerosis, in teenagers, in young people that are military recruits. Why do we know? Because of autopsies. They would find these streaks of fat. And that's why today it is recommended to check children for cholesterol. We are seeing shockingly high levels of cholesterol in children. We're seeing type 2 diabetes. We're seeing high blood pressure in children. So generally speaking, around 11 or 12, but if there's strong family history, it is recommended to check between 6 and 8 years old. It's not unusual to do so. So this is called primordial prevention when you even start earlier, when you start in the womb. And they have shown even the mother's diet matters to the fetus future. And then the other process to know there is atherosclerosis, then what's called thrombosis. Thrombosis means sudden blood clots, and this is what leads to sudden heart attacks and sudden death. And it's, again, no need to memorize all this, but it's a complicated process that leads to what's called platelet aggregation. Platelets are the clotting cells in the body, and they band together to block off an artery. And so the important thing to remember in here is nitric oxide. Nitric oxide is a substance that helps to dilate those small blood vessels. And that's why it was shown that the hearts restore the blood flow with plant-based diet. Nitric oxide is increased by greens and beetroot and many other plant-based foods. And so just know the lining of the artery is one cell layer thick, very delicate area that if it's compromised, suddenly blood clot happens. So this is what leads to sudden heart attack. And so these are two photos of arteries. On the left is an artery that's open. On the right is an artery that over many years has been narrowed and narrowed and narrowed, and the opening is very small. Guess which one is more risky and dangerous if it got clogged? The left one. Why? Because the heart is used to that left one being wide open, being a huge channel of blood flow, and when you compromise it, you shut off the blood flow. And one nick in this layer can cause that heart attack, sudden heart attack, which means sudden clotting. Interestingly, in the artery on the right, most likely because of the narrowed artery, there have been other channels of blood flow that have come into place, tributaries of the artery that have come into place, that they're a backup system already there in case this one got blocked off. So the endothelium, right, that one cell layer thick area, there are cells that generate and regenerate that layer. And those are called the endothelial progenitor cells, EPC. So you'll, sound very smart in front of parties and friends if you know what EPCs are. That's one level advanced. Interestingly, there is research showing with vegetables, those EPCs are increased, which means more healing capacity of the body. So many of us believe, body's a self-healing system, and we just have to do the right plan, and we can optimize the body's healing capacity. And so another process I mentioned was chronic inflammation, which is not just involved in heart disease, but many different diseases. We're talking about cancer, neurologic disease, lung disease, bone and joint disease, metabolic diseases, and autoimmune disease. And then we didn't even talk about stroke, but stroke is the same idea, but the brain's arteries. So why is chronic inflammation lowered with plant-based diet? Because those foods have antioxidants and phytonutrients, which work in various ways to decrease. And what we have as human beings, we have eyes to see colors. So while ancient man didn't have all this knowledge, he had eyes to see colors. And when the ancient man was picking the low-hanging fruit that looked pleasing to the eye, blue, green, red, purple, all those colors, and naturally we are trained to select variety, that ancient person was getting all of the antioxidants and phytonutrients, but not knowing about it. And then there's a new area of research that was discovered at Cleveland Clinic called TMAO, trimethylamine oxide, which relates the gut to the heart. And so what the story is the person would eat, animal-based foods, cheese, meat, eggs, and ingest what's called phosphatidylcholine, which would be metabolized by the gut flora into TMA, which you can see the chemical formula. By the liver, it's converted into TMAO, which leads to all kinds of vascular diseases, including heart disease, stroke, death, atherosclerosis, kidney disease, hypertension, and it's a new frontier of research. And of course, their idea is, we'll make a drug for it. But my idea is, and a lot of others, is why don't we look at the source, the root? And if you look all the way on the left in this graph, you will see the root. So just to go over the nutrient analysis, the nutrients, right? We traditionally, in the early 1900s, we discovered all these vitamins and nutrients and protein, and we thought, oh, if you just take this pill and that pill, you can be super healthy. Vitamin C, you won't get disease. No, that's not true. Because this kind of paradigm has been in use for so long, it leads to confusion, a lot of supplements, and actually poor health outcomes. No multivitamin has been shown to improve someone's health, believe it or not. In fact, they may actually worsen health by changing the balance. And so what's happening today is we have 63% of the American diet, roughly, as processed foods, with lots of oils, fats, sugars, refined grains. 25% is animal food. And then of the 12% of plant food, ketchup and fries are a big part. The actual plant foods are a very small part of the plant foods. Whole vegetables, whole fruits, whole lentils and beans. Lentils and beans aren't even on the food group for the U.S. Why are they not? And we are trying to change that with the USDA guidelines. They just don't have big enough lobby. And so what do you see on the shelf? You see aisles and aisles of processed food. You see lots of supplements. Just count the number of constipation aids that are on the shelf. Count the number of heartburn aids and probiotics. And so people think, oh, this is going to make me healthy. This is at the drugstore, of course. Why would they sell something that doesn't make you healthy, right? But the interesting thing is that you have to walk over to the produce aisle in the grocery store. But they don't have any labels. They don't say healthy strawberries. They don't say that. So, and then for the babies, do you see in the middle? They start off the babies very early. Fresh baby food, right? It's not fresh. It's processed. So yes, probably it's better than not feeding a baby. But people don't realize you can just puree stuff at home and feed it to a baby and they eat. And some babies are fed by what's called baby-led weaning, which is very popular in the United Kingdom, not as popular here, which is they are given softened, whole, hand-holdable fruits and vegetables, and they're trained to just put it in their mouth, taste it, and eventually they'll eat it. So it's a very different way of doing things. It is a lot of work and a lot of cleanup, but I've seen the results of it. So the new paradigm is called holism, where you look at the foods as synergistic with each other. nutrients don't work by themselves. An apple doesn't have that much vitamin C, but the action of an apple is very high. There are people today saying apples are bad for you, don't eat them. Anyone heard that today? So the fruit is not sugar, brown rice is not a carb, and avocado is not fat. So just know that they're much beyond. These foods don't have labels on them. And then the foods work in concert, literally concert, as in the nutrients work as in a symphony. Each instrument has its role. Each nutrient has its role. So the goal is whole plant foods, minimizing refined foods, added salt, and added fats. By added fats, I mean oils. And so just see there are a lot of factors affecting how many nutrients get in your food. So this is also why it's so important to consume whole plant foods as much as you can, because they're reduced. If you got everything fresh off the vine, that would be great, but you don't always get that. And so this slide, just to go over briefly, is showing that you get all the nutrients that you need on a plant-based diet. The nutrients are lacking in an animal-based diet. Even protein is full. What's very interesting that you can do as an exercise at home is, and I actually did this, I have the calculations at home. So compare 5 kilograms of broccoli. Put in a nutrient calculator, 5 kilos of broccoli. See what pops out. See how much calories, how much protein, how much fat. Believe it or not, there's omega-3 fats. And I wouldn't recommend it. That's a lot. So, but just for the sake of interest, you can do so. And then as a comparison, anyone watch Beauty and the Beast or read this story? So there's this character, Gaston, who's very fond of himself, right? And what does he do? When he was a lad, he ate 4 dozen eggs, but when he's grown up, he eats 5 dozen eggs. So just for an exercise, put in 5 dozen eggs in a nutrient calculator. See what pops out and see why it's such a bad idea. So Gaston probably needs a cardiologist. So look at this panda. Does he worry about the protein? Does he worry about nutrients? No. Literally, they just munch on the bamboo all day. This is when the great pandas were in DC Zoo and I took a photo. We just watched for an hour while they just munched and chewed on all this bamboo, and that's basically all that they eat. So as far as protein requirements, there is a calculation. The minimum for pound is about 1/3 or 0.4 if you want to be exact. Or if you do it in kilograms, you can do 0.8 grams per kilo. Now just know that if someone's an athlete, let's say they are a football player, they're burning 10,000 calories in a day. Guess what? The protein will be much increased if they're consuming 10,000 calories of food. And we know this from one of the bears who was consuming 10,000 calories of plant-based food per day. So just know animal protein is dirty fuel. Yes, of course, animal food will fill someone up, they will sustain them, but people won't thrive on an animal food-only diet. I am, believe it or not, seeing people today who are experimenting with so-called carnivore diets, which means BBBNE. They call it BBBNE. BBBNE stands for bacon, butter, beef, and eggs, right? And so someone was joking with me. They said instead of that, it should be banana, broccoli, beans, and exercise. That's what they said. So you can think of BBBNE, and those are good food groups to have in your diet, plant-based diet, not the other BBBNE. Plant foods are the best efficient fuel for the body. Nutrient-dense, anti-inflammatory, they increase energy, optimize athletic performance, reduce and treat cancer, and they prevent and reverse heart disease. Now, is plant-only healthy? Yes, if someone has them in balance and focuses on the 4 new food groups, fruits, vegetables, whole grains, lentils, and beans, they will be healthy. This has been developed thousands of years in Greece, in India. So does anyone know why Pythagoras is also famous besides the triangle? because he was one of the first to speak about vegetarianism. Now his was a very, unusual philosophy, but whatever it is, back then, vegetarians were not called vegetarians. There was no such word. You were called Pythagorean if you ate only vegetables. So phytochemicals are newly being discovered. Believe it or not, the USDA has no minimum requirement for phytochemicals. And if we look at how many Americans have enough, only 1/5 meet the minimum intake of phytochemicals, phytonutrients or phytochemicals. There's no daily reference intake. But these are essential to life, prevent cardiovascular disease, prevent cancer. Without these, someone will not thrive. They may survive, but they will not thrive. And these are just some examples. So flavonoids are found in pigmented foods, leafy greens, citrus, like green tea, berries and chocolate. Over 5,000 flavonoids have been isolated because we have the amazing technology today. So just see, for heart disease, they're antiplatelet. They actually prevent clotting and anti-inflammatory. Carotenoids, you may have heard of these, are in carrots and squash and vegetables and fruits and tomatoes. Carotenoids actually reduce muscle fatigue. So some of you may have heard a lot of athletes are doing plant-based. What you have not heard is those athletes don't want to tell others. Why? Because they don't want to lose their advantage over the other athletes. So it's a very quiet thing in the athletic community. And so they also regulate body fat and modulate obesity. And then you have non-starchy polysaccharides, such as in mushrooms and barley and oats, brown seaweed and wheat bran. They're kind of sticky, and so they have a lot of health benefits. But for our purposes, they actually take the cholesterol, they escort it out of the body. And that's how oats work, right? Like a cholesterol drug. The early cholesterol drugs bound up cholesterol, made it exit the body. And then we have lignans. These are some of the most powerful compounds. These, flaxseed goes way back. It was used to be called linseed. And it is 100 times higher in flaxseed. So if there's one food that I would say should be part of most people's diets unless they're allergic, it would be flaxseed. And now we know it even regulates hormones. It's a phytoestrogen, so it works in favorable ways. And it actually blocks the unfavorable effect of human estrogen. It protects against heart disease and breast cancer. And then glucosinolates, just as an example, sulfur-containing compounds found in cruciferous vegetables. And these are the list: cauliflower, kohlrabi, kale, broccoli, those kind of things, cabbage. So these are denatured by high heat. So you don't want to overcook broccoli when you cook it. You just cook it till it tenderizes a little bit or blanch it, but you don't want to pulverize the heck out of it. Then you inactivate the good compounds. So they are anti-cancer, anti-coronary disease, and regulate the immune system. And then soy has its own benefit, isoflavones. They act as agonist and antagonist for the estrogen receptor. So again, like flax seeds, they give favorable effects and they block unfavorable effects. I know someone who improved her menopause symptoms overnight with soy milk. They were originally thought to be harmful, but if you go to PubMed.gov and you research the effect of soy on breast cancer, you'll find it is actually opposite of what people thought. So anyone telling you otherwise is operating on 30-year-old information. And then you have omega-3 fatty acids, which are found in many of the foods we mentioned already. They are anti-inflammatory, have a role in heart health and brain health. And just know one trick is curcumin, or turmeric, can increase absorption of DHA by the neurologic system. And then, so this is just a review again. These are the colorful foods that have been shown to prevent cancer. And just to show you, these are also the foods that are optimal for inflammation and heart disease. So we have the fruits, we have the vegetables, we have legumes, nuts, and beans, grains, seeds, and flowers, especially the ones that have a lot of color. Yes, do you have a question? Omega-3, omega-3, yes. So curcumin increases the absorption of omega-3. Thank you. And for herbs and spices have their own anti-inflammatory benefits. And so this is a question. Every day we make a choice. Which one is more pleasing to the eye? Is it life or is it death? You know, that. Yeah, so that's right side is like graveyard for animals. Left side is life. So also it smells nice. You don't have to worry. If you touch some lettuce, you're not going to get dangerous bacteria on you, right? Yeah, you have to wash your vegetables, yes. But, you know, the danger of animal foods is much more. Now today, has anyone heard about something called H5N1? H5N1 is an influenza virus, and the beef industry and the dairy industry is shocked right now. Why? Because they have found H5N1 in the supply of beef and dairy. And even through pasteurization, they have found H5N1 virus present. So this is kind of hidden. You won't find these stories unless you look for them. But the good thing is we have the power of information today, and you can find out if you wanted to. So the question that comes up, is eating plants only healthy? Do you have to have animal foods? And the official statement from the Academy of Nutrition is yes, you can do very well, not only survive, but you can thrive with plant-based diet. And the interesting thing is the Academy of Nutrition says may provide benefits for the prevention and treatment of certain diseases. And then putting it together, this is from plant-based dietitian Juliana Hever's pyramid. You can see it's not hard to put it together. You just have to remember fruits and vegetables, whole grains, lentils and beans, and then healthy fat foods too should be part of plant-based diet. And then why are people, why do people lose weight when they go on plant-based diet? Because it fills the stomach. So you may have heard of stomach stapling. Well, this is the similar idea, but it's working in a different way. It's filling the stomach with light, water, and fiber foods. I'm sorry, say that again? Yeah, it's light fiber. So this is based on nutrient density. As you can see, vegetables, fruits, whole grains, and beans have very low calories per pound. We eat roughly 3 to 4 pounds of food per day on the high end. And so that 3 to 4 can be refined carbs, white flour, animal foods, junk food, sugar, and oils, or it can be on the top. So these are some other lifestyle factors. Dr. David Katz has a mnemonic: feet, forks, fingers, sleep, stress, and love. So this is, exercise, 150 to 300 minutes of exercise, or more, I would say. 2 days of resistance or more. We lose muscle mass as we get older, so it's so important to get your plant-based protein and exercise, especially as people age. And then plant-based diet, avoiding alcohol and tobacco, very important. Getting decent quality sleep, managing stress, and cultivating love. People with type A personality who have negative attitude, that's the people not only get ulcers, but get heart attacks. And there may be very well-meaning people, but through their lack of control of their careers may have stress. They also, may have more tendency towards heart attacks. So stress is an important factor. Now the last is going to be very important, and the slides have very small print. But what you can do, you can go to Cronometer.com, Cronometer, and I swear I don't receive any reimbursement from this company, but it's a free app with advertisements, or you can pay without the ads. So, you know what? Put it in. Put in a day's worth of food, see what pops up. This is just a very light plant-based diet that I just stuck in for the sake of example. Smoothie, chickpeas and broccoli, bulgur, which is cracked wheat, apple, peanut butter as a snack, bean, veggie, and kale curry. So this is a super healthy diet that I put in, right? Just to show examples. And then I put in 10 almonds. Why 10 almonds? Because it's small and it's not high calorie. So just to give you an idea, you put in each and every ingredient in the recipes I told you. So this, you have to put in the quantity. So for example, 1 cup of soy milk, raw spinach, 2 cups, bananas raw, 1 medium. So you can put in quantities. And so in this app, you put in each and every food, each and every ingredient. And in the end, this is what you get. You get an analysis of the whole diet of that day. So in this day's diet that I showed you, you have roughly 2,091 calories, which is a very healthy amount for someone who's active, who doesn't want to lose weight. And you have protein, 86 grams. 86 grams, which is very high actually, because everything adds up, little by little, it all adds up. And then fat, you have 83 grams, which yes, it's on the high end, but I'm going to show you what the analysis is. So you're meeting 100% of the targets for each and every vitamin. The other thing to know, 68 grams of fiber, which is about 4 times what the USDA tells you. And compared to typical American, it's probably 7 times of what a typical American would get. And then you have the fats. Yes, there is a lot of fat, 83 grams, but that's not so bad. Why? Because you have 500% of the RDA of omega-3 fats, which you may have heard you have to eat fish to get omega-3. I just showed you why you don't. And then you have saturated fat, which is very low, 11 grams. Very, very low in saturated fat. And then almost no trans fat, basically no trans fat, essentially. And then this is what everyone worries about. Will I get all my amino acids? It won't be balanced because it's plant-based. Guess what I'm showing you? If you consume enough calories, you will get much more amino acids than you need. So let's just assume that you need each and every one, right? Even the lowest one on here is lysine, which is 225% of what's needed. So you are more than adequate. The protein gets recycled and broken down in the body. But every day someone is getting more protein than required on this diet. And then all the minerals that people buy at the store. How many people buy calcium and magnesium and iron and those things? Everything is adequate. Even if someone is not absorbing all of it, they have more than enough in there. And even the trace elements, copper, 500% of copper, zinc, 130%. And that's part of the reason why I added in the nuts. Zinc is something that a lot of people do lack. You just have to consume a balanced plant-based diet. And if someone wants to know, they can just do this app and they can uncover any deficiency. Now I want to show you the opposite. I went to a keto website and I just listed one by one the foods that they recommended in the meal plan, just to see. So this includes butter, eggs, olive oil, fish, ginger, beef, raw eggs, Dijon mustard, so there's a salad in there with a little bit of cucumber, 2 ounces of cucumber, 2 ounces of lettuce, 2 ounces of onion, 1 ounce of cilantro. So yes, there are a little bit of plants in there, right? But most of it is fat and animal food, right? So then what happens? This is promoted by a diet website as something that's balanced. So what did I find on this so-called balanced diet? It is lacking in many different elements that are healthy. First of all, fiber is only 22% of the recommendation, almost no fiber, because you have 2 ounces of cucumber, 1 ounce of cilantro. Iron is there, yes, true, but I also showed you iron is there in plant-based food. We have calcium sorely lacking, vitamin C sorely lacking. Anyone know the name of the disease that happens when you don't consume vitamin C? Sailors get it. One more time. Scurvy, right? Right? Like they say pirates, limey, So That's why pirates consume limes to make sure they get their vitamin C, right? So you have definitely a lot of B12, which is great, but you can get B12 on plant-based diet if you consume supplemented foods. For example, supplemented soy milk, supplemented nutritional yeast, for example. You just have to work a little bit harder at it to get B12. Folic acid, the word folic comes from the word foliage, right? Foliage means plant food. Folic acid is sorely lacking in pregnant women's diets, yes, and that's why they fortify bread with it. That's why pregnant women are told you have to take folic acid supplements. Very interesting, there's a few vegan supplements for prenatal. They don't contain folic acid, or they contain little, or they contain the natural version. Very interestingly. But you see, look at all the yellows on here. You have yellow on vitamin D, vitamin C, folate. And vitamin D is going to be lacking in plant-based diet also. That is one supplement many people should take. But also vitamin D someone can get from fortified plant-based milk, just like people get vitamin D from vitamin D milk, right? So then let's go on. Amino acids are absolutely more than enough. Protein is more than enough, yes. So it is very easy to get so much protein on animal-based foods. However, the fat is heart-stopping, as in you are talking 817 milligrams of cholesterol, way above what the maximum is that we recommend. Saturated fat, this is almost 4 times as much as we showed on plant-based foods. And then minerals are lacking. These are the ones that people buy at the store. Calcium, magnesium, and then potassium. Those are lacking. So just to give you a few resources, these are a few resources that we have, and there will be resources on Salient Lifestyle Center's YouTube and web page, Facebook page, so you can find it. And very interestingly, fullplateliving.org is a program we will do here at Salient. We have done it in the past. And then one that is not on here that I want to tell you about is plantwisefilm.com, which is actually a film produced by Advent Health, which shows professionals at Advent Health Florida and how they recovered their health. The mayor of New York City wouldn't be the mayor of New York City were it not for plant-based foods. And then just to show you, Cleveland Clinic building, right? And the joke is this was Dr. Esselstyn's building. This was he shows it in all of his talks, so I thought I'd show you. And then this is a joke about the first day of medical school. Preventive medicine kills and return business. But on the other hand, I have to tell you, I am very impressed. I'm very fortunate to have gone to a school like Northwestern, where preventive health was at the forefront of what we learned. The only thing to know is, yes, it was in the beginning, the first 2 years, which are more of the classroom years. And then kind of it lost its charm the last 2 years. Why? A lot of the pharmaceutical companies influenced us the last 2 years. It's just what happens. This is what we're talking about. So the goal is to use less of this. Of course, medications are necessary sometimes, right? And some people have to take some medications every day. So just to show you an example, this is Srinivas from India, and a friend of mine whose house this is helped him to recover his heart disease and avoid coronary bypass. He was set up to have a bypass. He avoided the bypass surgery. Now, this doesn't always happen. It's very rare. I'm just showing it's possible in the face to show. He ran a 5K with me in Naperville area. So this is Albert Einstein at the National Academy of Sciences, and those are my children. And, you know, it's a rumor. No one knows for sure, but the rumor is that he kind of at the end of his life, he may have followed a more vegetarian diet. And at this scientific meeting, he said, oh, beef steak, that's lion's food. That's the rumor. No one knows for sure, but thank you, everyone. And I'd love to take any questions that you would have, either online or in our audience. I'm sorry? Text? Oh, sure. Yeah, that sounds great. If you have any questions, send it to us. Gabriel will text message me. And if any of you have questions about heart disease, please do. Okay, here we go. All right, I am looking now. How many people are online at this time? Okay, no problem. But yeah, I would say, look, if there are questions afterwards, I'll be happy to take them on the Salient Center Facebook page. You can message Salient Center's email, and I'll happy to take them.
Below the videos on YouTube.
Yeah, in the comments section. We will be checking. If you have questions, please do post, especially Facebook, especially YouTube. I'm happy to take them. And again, if I can't answer, I'll direct you. Yes, thank you. Yes, I will repeat the question. Yes.
I'm not scientific.
Okay.
I become very down to earth in my old age.
And that's what I like. Yeah, I like to teach both ways.
And I was arguing with the pastor a while back that even if I am a vegetarian, I'm going to die. But
Well, it is true. Everyone has their time. We don't know when that time comes.
Said, but you'll die healthy.
Yeah.
It's better to die healthy than to die sick.
True. Better to die healthy than die sick. Absolutely true. Now, this is what brings up something called health span. There's lifespan. Lifespan is the number of years you live. Health span is the number of healthy years that you live. So how we say in Creation Health, which is one of our programs, you want to add years to your life, yes, but also life to your years.
Yes. Well, I already eat vegetables. That's how I live with vegetables. But I like bread.
Okay.
I make bread and I eat bread. And I wonder if there's like a quick, maybe not, a quick mindset for me to eat healthy. Like,
Oh, eating healthy, quick mindset. So I will tell you, there are programs that are very easy. FullPlateLiving.org is such a program, and it's simple. It does not need to be complicated. It would be fruits. Fruits are easy. You pick up and eat them,
yeah.
right? Many of them you don't have to do much with. Then vegetables. The easiest way to get vegetables, if you don't want to cut, is frozen. You can buy a pound of broccoli for $1 or $1.50. Those are easy. You just throw it in the skillet with some onions and it's cooked. And then you have whole grains. Whole grains can be whole grain bread for some, like the, German bread, for example. Oatmeal is whole grain. And then lentils and beans. If someone doesn't want to cook them, we have canned beans available. We made a recipe, for example, at one of our programs that was the easiest chili recipe in the world. It had 3 ingredients. It had black beans, 2 cans, 1 can of 𝗵𝗄𝗃𝗃 salsa, small one, and then can of corn. It was that easy. We just put it in the pot, and it was done. No cutting, no preparation, nothing. So I want to emphasize that, yes, of course, plant-based eating can be very simple. You just have to choose some of the convenience foods that are plant-based, and it still will heal people. Yes?
Does it matter if the veggies are pale? Because I've heard a lot about colorful veggies.
Sure.
But, I like cauliflower.
So the good part is, okay, so does it matter if the veggies are pale, as in cauliflower is white, right? Cabbage is little pale green. Believe it or not, those vegetables have healing compounds. I showed in the slide about cruciferous vegetables. Cauliflower is very healthy. So you cannot go wrong. Generally, it's better not to overthink. The key is to try to have a variety of foods. And you see in the produce section, the nice thing is they have sales. 1 week carrots might be on sale, another week cauliflower will be on sale, another week cabbage will be on sale. So that's a good way to eat economically and healthfully. Yes?
How low should
So the guidelines from the American Heart Association on how low LDL should be with severe heart disease is as low as possible, which means with medications, it should be below 60, ideally, as low as is possible. And, you know, with severe heart disease, we do recommend statin drugs. They are dramatic. So, for example, there's 2 high-intensity statins, rosuvastatin, which is also known as Crestor, and atorvastatin Lipitor. So in the end, the person should absolutely be managed by a cardiologist to make sure they're getting the maximum treatment necessary medically. And some people, if they have a stent, they might require certain drugs that are blood thinners. Blood pressure should be perfect. Blood sugar should be as good as is possible. So in the end, I want to emphasize this is part of the treatment if someone has established disease. The other part is the medical.
Another question, should everyone have a calcium score?
So calcium score is somewhat controversial. Should everyone have a calcium score? I would say it depends what will happen with the calcium score. What I showed in my presentation is if everyone lived as if they have heart disease, what good will the calcium score do, right? Calcium score's intent was to identify those people who would have stent and bypass, but we showed in many studies, stent and bypass without symptoms is not necessarily life-saving. What's life-saving? Exercise and plant-based diet. So the calcium deposits don't show soft plaque. They don't show what the heart function is like. So one more thing I want to emphasize. There are cardiologists who are preventive cardiologists. They're happy to see someone concerned. They will sit down with them, assess their risk, and create a preventive plan. And if they go one step beyond, they will also recommend plant-based diet.
What are your thoughts about AG1?
AG?
AG1.
I'm not sure what AG1, are you talking about A1C? Yeah, I'm not sure what that is. Yeah.
Another question, what do you think of the clearly test?
Oh, clearly, I know about it. Look, you know, these are such new experimental tests. There's no saying. What I'm saying in my talk on lifestyle is follow this lifestyle, assume there's heart disease. If someone has been exposed to the Western diet, assume there's heart disease. Do you know what the first symptom of heart disease is in some people? Yes, you know about chest pain, you know about shortness of breath, but what is another? Sudden death. Sudden death. I can vouch for this. I have 3 friends who were males who passed away absolutely suddenly. One was 47, one was 52, and one was roughly 63. All 3 in the medical community. One was the husband of a doctor, and it was shocking. So, you know what, better to live as if you have heart disease. Who has time for all these tests and the money? So, generally speaking, the things that tell you risk, and you can put it in a risk calculator, are cholesterol, blood pressure, and age and gender, and family history. Those are the basic elements of a risk plan. One extra element of a risk plan is calcium score, but calcium score cannot detect soft plaque in younger people. And in older people, it will overestimate their risk because they will have calcium deposits from aging. Yes, one more question?
I have one question because quite a number of years ago, I was very heavy. And I went to a program in Lutheran and lost like 25 pounds.
Okay.
To an average weight.
So you were heavy previously and you lost weight through Lutheran General's weight loss program. Yes. Great job.
I had no health problems, but I lost a lot of weight.
Yeah.
I was taking medication for high blood pressure
Okay.
and high cholesterol.
So you were taking medication for blood pressure and cholesterol.
Yeah, when I went there, I was
Yeah.
So the doctor there at Lutheran told me, tell your doctor to get you off the blood pressure medication and the cholesterol medication because you really don't need those anymore. But my
So this is an element that's brought up. You're asking about going off blood pressure and cholesterol medication. This art is called deprescribing. And deprescribing is taught by lifestyle medicine. As someone improves their lifestyle, the medications may actually be harmful. So blood pressure pills, I've seen people drop their blood sugars and pass out. I have seen people drop their blood pressure and pass out. So it has to be done by someone experienced in lifestyle management. More and more doctors today are getting experienced, but it's something that really has to be pushed. What was right 10 years ago may not be right today. And that's all I can say is that you have to find the right doctor to deprescribe. Deprescribing itself is an art. Yeah, thank you.
I found 𝗂𝗂𝗃 is a foundational nutrition supplement combining vitamins, probiotics, and whole food source nutrients.
Okay, so I would say the 𝗂𝗃 is a probiotic and vitamins and nutrient supplement. There's nothing special about supplements. Most of them aren't tested clinically. I would say, where's the clinical study that shows 𝗂𝗃 saves lives? Where's the clinical study that shows this so-called 𝗂𝗃 reverses disease? I just showed you foods that are available in the grocery store are prevent and reverse. So let's say there's a supplement, hypothetically, that costs $200 a month that you can buy that's supposed to improve health, right? What else can you buy with $200? You can buy a lot of groceries. You can buy membership at a very nice gym where they do intense exercise. So this is called opportunity cost. And just know, everyone in the US is looking to make a buck, all right? Who is not looking to make a buck? Our nonprofit center. It's nonprofit for a reason. And many people in lifestyle medicine, we give away our classes for free. A lot of these documentaries are freely available. We are just giving it away. However, what's interesting is many people would rather pay $1,000 a month for health. Whatever's free, they won't appreciate or value. So I would say, look, the best thing someone can do who is interested is watch Plant-Wise Film, www.plantwisefilm.com. In the US, it's available for free. Outside of the US, there are websites we can give you. If anyone is watching this from outside the US, just put a comment. I will tell you how to view it. But, you know, that movie is just a 45-minute film that shows you what's possible. You'll see amazing transformations through nothing special, no special medication. If I had a pill that did what exercise can do, everyone would buy it and they'd be willing to pay $1,000 a month for it. As far as medical drugs, the sky is the limit with cost today. We used to think, oh, $200 per month is expensive. Now, we are willing to pay $20,000 a month for medications. It has gone shocking what is able to be charged. Yeah, thank you so much. Thank you, everyone, for your time, and we hope to keep in touch. Thank you. Thank you. Thank you.